My name is Dr. Mukesh Rulania, Associate Professor, SMS Medical College, Department of Medical Oncology. Today I will describe about what is prostate cancers, what we have prostate cancer patients are presented to us, and what is management of prostate cancer. So as we know, prostate cancer is a disease of prostate glands. Prostate glands are located below the urinary bladder in males, and hyperproliferation of cells in the prostate glands leads to prostate cancer. And this is disease of elderly populations. Approximately 1 to 8 males worldwide are affected from prostate cancer, and this is a second most common cancer in males. Coming to what are the risk factors, as this is especially age is the most common risk factor. If we are older, then risk is increases. Coming to race again, black people are higher risk as compared to white population. Genetic history: the patient have a family history of any cancers like ovary, pancreatic, breast, then they have higher chance of developing prostate cancer, especially if they have BRCA1 and BRCA2 mutations. Coming to another factor, some dietary factors also responsible for prostate cancer, like obesity, lack of physical inactivity. So what are the common presentation of prostate cancers? So if patients have localized disease, then they can have urinary symptoms that is known as roots, lower urinary tract symptoms, like increasing frequency, incontinence of urine. Sometimes they have pain during urinations, sometimes bleeding during urinations, and sometimes if a patient are metastatic, then have bone pain in spine region. Coming to what are treatment options, what are survival of prostate cancers? As we know, have a survival of localized prostate cancer is 100%. 10 survival approximately 98%. So if patient have localized disease, then they have excellent survival. If patient have metastatic disease, the survival is decreasing approximately. High survival is 60 to 70%. So what are treatment options of prostate cancers? If patient have localized disease, then we stratified according to various parameters like Gleason score, PSA, and clinical staging according to MRI and digital rectal examinations. So if they have a very low risk, intermediate risk, favorable intermediate, unfavorable intermediate, high risk, and very high risk, and we treat according to that conditions. If patient have very low and low risk, then patient can be observed and can be put on surveillance. Patient have intermediate and high risk, these patients require treatment according to clinical conditions. These patients can be underwent radical prostatectomy or EBRT with medical ADT. Coming to metastatic prostate cancer or advanced prostate cancers, if patient is metastatic, then medical ADT, androgen deprivation therapy, with various combination therapies to the ADT like abiraterone, enzalutamide, docetaxel, apalutamide, darolutamide, and sometimes these patients develop castrate-resistant conditions, and these conditions are treated with various therapies and which are approved in various guidelines, like if patient does not receive then docetaxel, cabazitaxel, martrogentrone, abiraterone, enzalutamide. So these therapies are excellent. They have minimum side effects and they are easily tolerable to all the patients. And these patients have good quality of life on this treatment, and they can tolerate up to long times because prostate cancer patients have long survival. Coming to what are screening recommendations, because this prostate cancer can be screened by simple PSA and DRE. So various guidelines recommend patient who high risk, then 45 cutoff. If you are 45 and above, you can consider PSA testing yearly. Some guidelines recommend age cutoff to start PSA screening. It's 50 years, and then if you are 50 and more than 50 years, then we start serum PSA testing yearly till 75 years age. However, this screening PSA test is not standard because sometimes PSA also increases benign condition like BPH, benign prostatic hyperplasia, Sometimes prostatic infection, some and many other conditions also increases PSA. So sometimes this test can be false positive, and this can be confusing and distressing to patients and doctor. So this is not a standard test, but PSA with DRE definitely a more sensitivity as compared to simple PSA. But guideline DR is difficult for as a screening, so guideline recommend PSA testing, and PSA can be followed as a just simple blood test. So coming to my conclusions, prostate cancer is a very heterogeneous disease, and these patients have excellent long-term survival outcomes. These patients have many treatment options, and these patients have good quality of life on these treatment options because these treatment have minimal side effects. So all patients of prostate cancer don't worry. Many therapies are available to these cancers, and usually prostate cancer have excellent long survival. Thank you.